My name is Katrina Martinez with Liberty University, a sales presentation on a chemical dependency program. In a large organization, the variety of employees can have many challenges from a diversity of cultures and beliefs, as well as individual employee deals with work-related stress. One niche of employees are the active and inactive military personnel. Due to the extreme nature of war and training, a service member is often under physician care and treated for a range of associated mental health conditions, such as anxiety and post-traumatic stress disorder, PTSD. Through a visual presentation, sales presentation to an employee assistance professional will address a chemical dependency program that would offer support to their military employees and to promote increased employee performance. The sales presentation of a chemical dependency program to an employee assistance professional, an EAP, requires an understanding to the role of the EAP. The employee assistance, EA profession, is to address work organization productivity and job performance. According to the Employee Assistance Professional Association standards and professional guidelines, and for the purpose of this sales presentation, the role as consultation to work organizations to encourage availability of and employ access to health benefits covering medical and behavioral problems, including but not limited to alcoholism, drug abuse, and mental and emotional disorders. As individual assistance to employees and their family members who are experiencing personal difficulties in a confidential and timely problem identification that may affect job performance and productivity issues to improve and maintain the health function of the workplace. According to Berkowitz, had conclude, sales forces can be organized geographically by product or by customer type. This sales presentation is not specific to geography, but is by product, the chemical dependency program, and by customer type, the inactive and inactive military personnel. The three sales approaches used in this sales presentation are the stimulus response sales approach, the selling formula, and the needs satisfaction method. The chemical dependency program to integrating military personnel in alignment with the three sales approaches are occupational effects of PTSD, workplace accommodations, and the chemical dependency program. The following questions will be asked at the beginning of the sales presentation and relate to the occupational effects of PTSD. Is substance abuse and chemical abuse an issue for your organization? Is this issue negatively affecting the efficiency and productivity of your employees? Do you want to improve your overall productivity by addressing this issue? If your answer is yes to all of these questions, then our chemical dependency program can help your employees overcome substance abuse on a sustainable basis. The following questions will be asked after a particular response is achieved after the stimulus response approach and relates to workplace accommodations of the selling formula and includes AIDA, attention, interest, desire, and action. AIDA is a series of steps to move along in conversation and learn more about the customer to have more active part in the sales process. Why does your organization need a chemical dependency program, CDP? What is the outcome that you expect to achieve from the CDP? How familiar are you with PTSD? According to the Substance Abuse and Mental Health Services Administration, there are an estimated 23.4 million veterans, 2.2 million service members, and 3.1 million immediate family members, of which from the Iraq and Afghanistan war, 18.5% of the service members have PTSD or depression, while 19.5% reported during deployment had report traumatic brain injury, TBI. And finally, between 2004 and 2006, 7.1% of U.S. veterans met the criteria for substance abuse disorder, SUD. The U.S. Department of Veterans Affairs, the neurotransmitters of the brain in a person with PTSD have different amount of these chemicals than those who do not have PTSD, and that such changes in the brain might also be related to the ability to manage stress. A list of antidepressant medications for the treatment and coping of PTSD are related to those administered for anxiety and depression are believed to treat PTSD by putting these brain chemicals back in balance. Chemical dependency program relates to the individual as needing to maintain prescription use that are chemically dependent on relief of symptoms and in order to return to daily living conditions. Chronic pain medications prescribed for TBI could include opioid painkillers along with Percocet and OxyContin, making news in recent years as being highly addictive. According to Dabbs Watkins Fink, Costin Milliken, as diagnoses for PTSD and opiate dependency and abuse continue to rise, improved awareness and attention needs to be placed on service members diagnosed with PTSD. Finally, the following questions will be asked that are customer-oriented: needs development, needs awareness, and needs fulfillment while relating to the chemical dependency program. Why do you need a chemical dependency program? How has performance levels decreased due to their chemical dependency? Reintegrating into civilian life and the workplace after a demanding environment of military life, the active and inactive service members face critical issues experienced in combat and training along with psychological distress of the trauma. Substance abuse and related disorders further complicate daily living activities, and the workplace chemical dependency program demonstrates the awareness and support from the employer. The occupational effects of PTSD and SUD are characterized by behavior the EA is addressing through the chemical dependency program and will highlight various options to ensure increased work productivity. These various options are the workplace accommodations that serve the chemical dependency program for a healthy environment. America's Heroes at Work, Step 1, is to design a strategy and create a plan that supports an inclusive workplace and to retain the loyalty of the service member. Workplace accommodations would be to offer a flexible schedule to avert absenteeism and due to medical appointments, allowing for frequent breaks, phone accessibility, and in-company veteran mentorship will allow the service member a healthy zone to meet in privacy and could offer a telecommuting option to immediate cognitive behavior treatments and cognitive processing therapy counseling. While under physician care of PTSD, chemical dependent treatments, not all strategies will be effective for all employee service members. The EA will need to retain an individual support plan to include a behavioral support plan for best practice to create a welcoming and productive environment. A healthy work environment also places value on the military service and a relationship with the local Veterans Office, as the United States Department of Labor suggests for an EAP to have direct access of resources for the employee service members. By reducing clutter and distractions that could be triggers setting off unwarranted behavior, the chemical dependency program could include sound therapy of ambient music played throughout the workplace. According to the Office of Disease Prevention and Health Promotion, mental health is a state of successful performance of mental function, resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with challenges. Furthermore, according to Das Blazek and Marek, integrated approaches to the treatment of PTSD and SUD focus on empowering clients by fully engaging them in treatment and using a collaborative decision-making process. Actively engaging the service member to be proactive in their chemical dependency program would instill workplace unity and increase productivity. And such concludes my presentation.